Hello everyone, myself Dr. Harshada Gaikwad. I'll be taking the topic brachial plexus. So whenever we discuss brachial, so whenever we say brachium, it means something related to the arm. And plexus means network. Okay, so brachial plexus is a network of nerves which is formed by the anterior or the ventral primary rami of last four cervical. Okay, that is C5, C6, C7 and C8, and first thoracic, that is T1 spinal nerves. So what exactly is ventral rami? Okay, so every spinal nerve is formed by a dorsal root and the ventral root. Okay, so the dorsal root has sensory fibers and the ventral root has the motor fibers. So when these fibers unite, it forms a spinal nerve. This spinal nerve will further divide and form a dorsal ramus and ventral ramus. Okay, so this rami means projection. Okay, so the ventral ramus as well as the dorsal ramus will have both the fibers. Also remember that the ventral root will be joined by sympathetic fibers. Okay, this we will be requiring in anatomy, clinical anatomy. This is what ramus means, the projection, right? So the spinal nerve will give ventrally ventral ramus and dorsally the dorsal ramus. So this is the diagram that we see in BDC. So let's make it more simple. So brachial plexus, when it gets the roots, sometimes it may get it from C4 and T2 as well. Okay, when there will be presence of C4 and T2 will be absent, it is called as prefixed brachial plexus. And T2 is present but C4 is absent, it is postfixed brachial plexus. Now we will see what are the components of brachial plexus, that is what all it is made up of. So it is made up of the roots, the trunks, the divisions, the cord and the branches. Okay, so to make it more simple, we remember it as read the damn cadaver book. Okay, so that is roots, trunk, division, cord and branches. We have to remember it as it is because it follows its way like that. So remember that the roots and the trunk is above the clavicle, that is supraclavicular, right? The divisions are behind the clavicle, that is retroclavicular, and the cords, right? So the cords are infraclavicular, that is below the clavicle, that too in the axilla. Okay. So we'll discuss each and every part in detail. So as we have already seen that the roots are C5, C6, C7, C8 and T1. That is the last four cervical and the first thoracic, right? So as we have already seen in the definition, so it is formed by the anterior, as we have already seen, that is the ventral primary rami of C5 to T1 spinal nerves, right? So these roots are present deep to the scalenii anterior muscle, which is one of the muscles present in the neck, right? Now, these roots, they unite to form the trunks, okay? So the roots C5 and C6, they unite and form the upper trunk, right? C7 continues as the middle trunk. The C8 and T1, the roots unite and form the lower trunk. Okay, so these trunks, they are covered by a fascia that is called as the prevertebral fascia. So they all are covered in a sheath called as axillary sheath, which is ultimately derived from the fascia, that is the prevertebral fascia. Okay, now these trunks, every trunk gives two divisions. One is the anterior division and one is the posterior division. So this black, all the black are the anterior divisions. This orange is the posterior division. Okay. So every trunk gives two divisions, anterior division and posterior division. Okay. Remember that the divisions are present behind the clavicle, retroclavicle. Now these divisions will form the cords. Let's see how. So the anterior division of the upper trunk and the division of the middle trunk, they unite together and form the lateral cord. Okay. The lower trunk, its anterior division continues as the medial cord, and the posterior divisions of all the three trunks, they unite and form the posterior cord. Okay, so this is how the cords are formed. Now, how do they get their name? Lateral, posterior, medial. So it depends on the position they surround the axillary artery. Okay, so the lateral cord will lie laterally to the axillary artery. Posterior cord will lie posteriorly to the axillary artery, and the medial cord lies medially to the axillary artery. Okay. Now, so the roots, the trunks, and the cords, they all give branches. Okay. So the bracket that I have written, these are the nerve roots. So nerve roots means what? From the roots they have been formed. Okay. So the roots, they give branches as nerve to serratus anterior. So serratus anterior is a muscle which helps us in overhead abduction. Okay. This will be required in clinical anatomy. Now, serratus anterior nerve is also called as nerve of Bell. Okay. Also called as long thoracic nerve. Next is the muscular branches. One is nerve to rhomboids, and that is also called as dorsal scapular nerve, and branch to phrenic. So phrenic, whenever we say, it means diaphragm. So this will be supplying the diaphragm. Remember that it is written that it is C5, but it receives more root fibers from C4, and C5 has only small nerve roots. Okay. The trunk. So only from the upper trunk there are two branches. One is suprascapular, another is nerve to subclavius. Important point is that branches of the cords, which we have to remember. So the lateral cord gives three branches. One is lateral pectoral nerve, second is lateral root of the median nerve, and the musculocutaneous nerve. So we remember it as lucky meat. Okay. Next is medial cord, which is medial pectoral nerve, medial root of the median nerve, medial cutaneous nerve of arm, and nerve of forearm, and the ulnar nerve. So all these have C8 and T1, but ulnar nerve has C7, C8 and T1 as its nerve root, as its root value. So why? So as you can see, this is the ulnar nerve, which is the branch of the medial cord. That too, it has the root value as C7, C8 and T1. So why? Because it gets its communicating branch from C1, C7. So that's why it has got its root value as C7, C8 and T1. Okay. So this is easy to remember, that is M4 and U. So posterior cord gives 5 branches. One is upper subscapular, lower subscapular, thoracodorsal nerve, also known as nerve to latissimus dorsi, radial nerve, and axillary nerve. This we remember ultra. Okay. So these 5 are the main branches. Radial nerve, ulnar nerve, axillary nerve, musculocutaneous nerve, and medial nerve. Okay. So this we remember as my aunt raised my uncle. Okay. So these are the main branches that supply our upper limbs. Okay. So brachial plexus mainly supplies our upper limb and our thorax. So of which these are the major branches which we have to remember. So now we will see the clinical anatomy of brachial plexus. So first we will see Erb's paralysis. So there is something called as Erb's point. So what is the Erb's point? Erb's point is a point that is present on the upper trunk where the 6 nerves, that is C5, C6, suprascapular nerve, the nerve to subclavius, and the anterior and posterior divisions of the upper trunk, they unite. Okay, so whenever there will be injury to the Erb's point, which is located on the upper trunk, there will be Erb's paralysis. Okay, so as there is injury to the upper trunk, the nerve roots that will be involved are C5 and C6. So when there will be injury, so firstly is the birth injury. So this angle, the head and the shoulder, right? As we know that the roots are present over here, the upper trunk is present in the neck, supraclavicular. Right? So this distance between the head and the shoulder, whenever this distance will be excessively increased, there will be stretching of the brachial plexus and injury of the, then there will be Erb's paralysis. So another thing that will be that when there is fall on the shoulder, such that the angle between the head and the shoulder is increased, right? So these are the causes for Erb's paralysis. Now, what is the deformity that is seen in Erb's paralysis? So it is called as waiter tip deformity or policeman tip deformity, also called as porter's tip deformity. So as you can see, like this, the hand, this is the affected hand due to injury of the brachial plexus. So the person is like this. So what all things that we see? The hand is adducted, right? So the hand, the forearm is in pronation, right? Then the hand is medially rotated. Also, the person will not be able to abduct his hand, right? And flexion is also not possible. So this is why it is called as waiter tip deformity, as if the policeman or the waiter is taking the tip. Okay, so here it has got its name. Okay, so the muscles that will be involved are biceps, deltoid, then the brachialis, brachioradialis muscles. Now, case paralysis. So in clump case paralysis, as we all know, the nerve root will be involved is C8 and T1, as there will be injury to the lower trunk. So this is upper trunk injury, this is lower trunk injury. So nerve roots involved are C8 and T1, right? So as we know that the lower trunk is present infraclavicular, that is in the axilla. So whenever this distance, the distance between the shoulder, the arm and the trunk will be excessively increased, stretched, as if someone is holding on to something, then, or a birth injury, right? So in these two conditions, there will be injury to the lower trunk, which will give rise to the clump case paralysis. Okay. Now, what is the deformity that is seen? So this is the deformity. The deformity is called as claw hand deformity. So what do we see? So in this, there is hyperextension. So hyperextension of metacarpopharyngeal joints, and there is of the interphalangeal joints. So it gives an appearance like a claw of a bird, right? So the muscles that will be involved in clump case paralysis are all the intrinsic muscles, because main nerve that will be injured is ulnar nerve, right? Next deformity is the Horner syndrome that we see under clump case paralysis. So whenever there will be injury to the lower trunk and at the same time there is more harm to the T1, then there will be Horner syndrome. So in Horner syndrome, also the sympathetic fibers that I had already discussed, the ventral root gets its sympathetic fibers, so they'll be also at fault, they'll be also injured. So this is the normal eye and this eye is the harmed eye. Now what all things do we see? First thing is ptosis. So what is ptosis? Ptosis means drooping of the eyelids. Second thing is meiosis. So meiosis means constriction of the pupil, right? If you compare, this pupil is being constricted. This is normal pupil. Okay, so we saw first is meiosis, second we saw ptosis, third is enophthalmos. N means inside. So it shows that the eye is being moving inside the orbit, right? So how do we know this? You can see this upper lid is being move outwards, right? So it shows that there is an ophthalmos, right? So as there is sympathetic fibers that are also harmed, so what are other things that we can see? So first thing is ciliospinal reflex. So there is loss of ciliospinal reflex. So what is this ciliospinal reflex? Whenever we pinch the face, so there is dilatation of the pupils. But in Horner's syndrome, it will be absent because the sympathetic fibers are lost. Also, there will be anhidrosis, that is less sweating. So there will be dryness of skin. So this is regarding the Horner's syndrome. Now, we see the third and the last deformity, that is winging scapula. So when do we see the winging scapula? Winging scapula is seen when the nerve to serratus anterior is damaged. Okay. So the serratus anterior is a muscle, as we had already seen, that it helps in overhead abduction. At the same time, it keeps this scapula onto the rib cage attached, right? So whenever we push something, whenever we pull something, our scapula doesn't come outside, it doesn't wing, right? So that's why whenever there is injury to the serratus anterior nerve, there will be winging of scapula. So what is winging of scapula? The medial side and the inferior aspect of the scapula will be seen prominent. Whenever the person will try to move something or push something, he'll not be able to do due to the winging of scapula. So when it will happen, when there will be excessive pressure on the shoulder, at that time, or whenever there is excessive injury on the shoulder, sudden injury, there will be injury to the serratus anterior, giving rise to winging scapula. Thank you.